All right, so the composition of the urine is something that's important to know. And it is basically, remember, filtration, reabsorption, and what was the third one? Secretion, right? After all of that, you will end up having the final urine. After you took back everything that you need, especially water, nutrients, ions, and other things, and whatever reach the papillary duct, which is at the tip of the papilla, or at the papilla, which is at the tip of the pyramids, whatever is leaving from there, this is going to be the actual urine. Um, So the normal urine should be, and this is important, you have to know this, it should be clear, it should be sterile. So you're not supposed to have pathogens, you're not supposed to have any turbidity, like you see something hanging or like bulks in it or something. The concentration, it depends. So it can be like a little bit diluted, a little bit concentrated. That's not a big deal, but it has to be clear, sterile, and normal concentration, which is a range. And the yellow should be, the color should be yellow. And why is it yellow? Urobilin. I don't know if you guys remember or not, but we talked about what happened when we break down the red blood cells. You end up having the bilirubin and it get conjugated, go to the urine or go to the kidney. Part of it go to the digestive system. The remnants of the bilirubin that stay in the urine is called urobilin. And this is what give it the yellow color. For the stool, it's yellow also. Remember, it was stercobilin. Stercobilin. This is urobilin. The bilin, which is the bilirubin of the urine, basically. So it has to be yellow, yellow like light yellow, dark yellow. It's okay as long as it's yellow. It depends on the amount of water in the urine. And we can do actually urine analysis in order to understand if everything is okay or not. If we do urine analysis, you don't need to know the numbers. I want you to know that the volume is from zero point 0.7 up to 2 liters. 2 liters is like the maximum. Water is 95% on average. It's 93 to 97, which is like 95 average. Color, yellow. Clarity, it should be clear. Odor, it depends on the type of food that you're having, and it should not contain bacteria. This is what you need to know. Volume, color, clarity, odor, and bacterial contents, which is nothing. How about nutrients? Are you supposed to see any nutrients like glucose, amino acids, proteins, lipids, anything? Zero. You're not supposed to see anything. If you see any, there is something unusual, right? Because we do absorb 100%. Where? Huh? Distal? Proximal. Proximal. We absorb 100% in a proximal convoluted tubule. Same slide again. I told you guys you will see 3, 4, 5 questions in that slide alone. So you should know what are we talking about. But let me ask you this question, not numbers, doesn't have to be numbers, but what is more concentrated, osmotic pressure or osmotic concentration? Is it the urine or the filtrate? Why? Yes, but because you reabsorbed 99, 98% of the water. So all these things that was there, it's the same thing, but it is in less water. So it is actually more concentrated, more concentrated. And is it less water or more water? Less water because you already reabsorbed the water. There is something called creatinine clearance and BUN, blood urea nitrogen. These are the tests that can tell us if the kidney is working fine or not. What's the creatinine clearance? Creatinine clearance is, remember I told you the waste products that you need to remember? Creatinine, urea, and uric acid. Yes, the three, right? And creatinine come from the destruction of These are the things that I asked you guys to remember. I told you where is each one of those come from. Breakdown of what? Breakdown of what? Breakdown of what? Creatinine come from creatine phosphate, right? Urea proteins. Uric acid, nitrogenous bases, which is like DNA and RNA and stuff like that. You need to remember this. So creatinine clearance, basically, we measure it in the blood, we measure it in the urine, and we compare. There is a ratio between those two. If you are within that ratio, it means your glomerular filtration rate is fine. If less or more, it means it's abnormal. And what's the glomerular filtration rate? The number is 125. But what is it? Definition. Glomerular filtration rate. Rate of filtration from the glomerulus. Per what? Per minute, per hour, per week, per day, per minute. Okay. And how about the bond? Blood, urea, nitrogen. What's the importance of that? Because the nitrogen in the blood or the urea nitrogen should be low. As long as the kidney is working fine, you take it and throw it in the urine. Isn't this is waste product, urea? If you're not doing the work, it means urea is going to accumulate in the blood. So that type of nitrogen is going to increase. It means you're not doing a good job. So it should be as low as possible. If it goes up, you're not doing the job. Clear? You should get rid of it. If you don't get rid of it, you're not working good. It is going to accumulate, increase. That's it. If it increases, it's bad. This is something called pilogram. You don't really have to know much about it. It's just something that uh, pilogram. It's they inject something and they take a picture from outside. Basically, it let us know if everything is working fine or not. Look at this. You will see everything okay. Here are minor calyces, major calyces. This is the pelvis, ureter, bladder. Everything is okay. How does it look like if there is something unusual here? Like this, look at this. This is kind of smaller. This is not blocked. It can be a little bit narrow. Or if it comes to this point, for example, and then there's nothing here, it means it is closed, or there is something wrong blocking it. Now, there is an important type of epithelium that we talked about before that is lining the whole urinary tract. Tract is a urinary tract same as urinary system? No, urinary system include what? Beside the tract. Include the kidney, right? Kidney plus tract is a system, right? So without the kidney, the system, starting from the pelvis, all the way down, this is transitional epithelium. What's transitional epithelium? This is AP1, but let me remind you, transitional epithelium is an epithelium that does not have a fixed shape. It transitions like this. It goes like this. When you fill it up, it changes to become like this. If the bladder or whatever is not stretched, it will look like this. So what's the shape? It depends. Can be cuboidal. It can squeeze itself like this. It transitions from shape to shape. So this is an important one to remember, that it is lined by transitional epithelium. Ureters, each one of the ureters will go back behind the bladder and it will enter the bladder. When it enter, the orifice there, fortunately, it is slit-like. It's not like this. It's not like something round and it goes like this. No, it's a slit-like. So the opening looks like this. Slit-like for a reason. Everything is happening for a reason, right? Why is it slit-like, not like round like this? Slit-like. Because you want the urine to leave the ureter, go to the bladder, and doesn't come back. If it is slit like this, it can push it and go out, and it cannot go backward. Kind of. It acts kind of like a valve. So preventing the backflow. If this is not the case, it's abnormality. Do you think the urine should go back from the bladder to the ureter? Of course not. If you go to the ureter and then add up, it will go to the kidney, right? Do you want the urine to go back to the kidney? It will compress on the kidney and the kidney is going to die, right? So no, urine leaving the ureter, going to the bladder, it should not go backwards. Why? Because we have this slit-like opening that act like a valve, kind of like a valve. If it is not working, you know what we call it? Uretrovesical reflex. It's a reflux, meaning the urine go from the bladder back to the ureter, which is obviously something wrong. The wall of the ureter, just like all of them. So if you know one, you know all of them. No need to repeat. All of them are mucosa, muscularis, and serosa. Do you remember this? Mucosa, epithelial cells. What type of epithelium? All of them are transitional. Middle layer is always everywhere, and you guys know that. You guys know that every single tubular shaped structure in the body, whatever it is, digestive system, urinary system, blood vessels, anything, the middle layer is muscles, right? So middle layer is always muscles. And then a connective tissue outside, just like anything else, okay? The only thing that's unique is transitional epithelium. So we need to be specific here. The inside is mucosa, it's epithelium. Yes, what type of epithelium? Transitional epithelium. So here is transitional epithelium inside, and then muscles, and then connective tissue outside. Um, the urine, as it is moving down the ureter, it is moving down, it goes with gravity, so that's okay, but not good enough. You wanted it to go like faster. So there are peristaltic contraction. Do you guys remember the peristalsis versus mixing? Peristalsis goes one way. So the peristalsis, like the urine is moving down the ureter and moving into the bladder. It doesn't go like fast enough. So peristalsis go like milking it down like this. One after one after one, it goes fast so that it push it faster to go into the bladder. And in the bladder, it's going to be stored temporarily. Okay? Bladder can accommodate up to 1 liter. This is not the normal. We're not supposed to have like 1 liter all the time. That's not normal. This is the maximum. It can take up to 1 liter, and you should remember that. Normally, we have like a quarter of a liter, maybe half a liter, and then you feel like you want to go to the bathroom and you empty. Okay? Only if you have an issue and you cannot find the bathroom, whatever is happening, and you have to hold it, your maximum is, which is the full bladder fully stretched. And you need to remember this number. The bladder is held in place by different types of ligaments and peritoneal folds. And here it is. This is obviously a male. Here is the bladder. Behind the bladder, there are some reproductive organs, internal, and behind it is the rectum, right? Which is different than females, because in females, in the front here, you have what? What do we have here for females? Or or in between here? What do you have? The third one that's not here? Uterus. You have uterus in females. In males, you only have this bladder, rectum, and reproductive organs in between. Obviously, urine leaving will go to the prostatic urethra. What is this part of the urethra? Right here. If this is your lab exam and we have a small arrow pointing to this, what would you say? Membranous. Membranous. What is this part here? Prostatic. And this? Membranous. It's inside this membrane. What is this membrane? The membrane is urogenital diaphragm. This diaphragm is a membrane. Since this is inside the membrane, we call it membranous. And what's surrounding this membranous urethra, like here and here? What is this? Which sphincter? Yes, it is a sphincter. External. Where is the internal? Here, right? Is this voluntary or involuntary? This one, voluntary. And what is this one here? Spongy or penile? Spongy or penile? Here is in females. The bladder is here, the rectum is here. What's in between is the uterus right here. And then the vagina. And this is the reproductive organs, external reproductive organs. And we're not talking about this now. Um, for the umbilical ligaments that are attached, it's the remnants. Remember, in the fetus, there are a lot more opened vessels and ducts, right? And then it's closed. When it's closed, we call it ligament. Ligament. So we have median. Median means not medial. What's the difference? Median with N versus medial with L. Yes, median with N is in the middle. Medial closer to the middle. These are two different terms. So median is in the middle. Lateral is outside. And the median, um, again, it's in the middle. And the lateral ones used to be the umbilical arteries. Look at this picture right here. There is a strong muscle inside the bladder. Remember, the bladder, just like any hollow organ in the body, all of them are the same. There is no difference, all of them. There is mucosa and muscularis and connective tissue outside, whatever you want to call it. So this mucosa that contain the rogues, and what kind of epithelium do we have here? Transitional. And there is a very strong muscle in the wall. And what's the name of this muscle in the wall? Start with D. Detrusor, yes, detrusor muscle. You have to remember this. Basics, detrusor muscle, you have to remember it. And this is the trigone. We can ask you what are the 3 points that make the trigone. Openings of the ureters of both. Orifice or opening is the same thing, right? Orifice, opening. So right and left ureter openings. And the third point is the exit to the urethra, the beginning of the urethra. That surrounding, look at this part of the muscle, just this part. Internal, internal urethral sphincter, right here. So here is a prostatic urethra. And what is this urethra here in the membrane? Membranous urethra. So here is mucosa that contain rogae and the trigone, triangular area. You should know the 3 points that make it. And this act like a funnel. It funneled the urine down to go to the prostatic urethra or to the urethra, generally speaking. If it's a female, it is just a urethra. And in the neck of the bladder is the internal urethral sphincter. So if I ask you, it is in the beginning of the urethra, which is the neck of the bladder. This is what contain the internal sphincter. Is that voluntary or involuntary? Involuntary. Innervation, we have parasympathetic fibers. And when these parasympathetic fibers, when it's charged, it contract the detrusor muscle, right? And it open the internal sphincter. But is the external sphincter open? No. The external sphincter have nothing to do with this because parasympathetic and sympathetic is autonomic. Autonomic. Autonomic is involuntary, isn't it? Autonomic is involuntary. So parasympathetic, this is going to work on contracting the muscle and opening the internal only because it's autonomic. The other one, the external, is skeletal muscles. It's voluntary. So this is the one that has to be opened voluntarily. So here is the detrusor muscle. Urethra, take the urine from the bladder all the way to the outside. I don't have to go through the layers. It's the same thing. Everything is the same thing. Mucosa, muscularis, and connective tissue outside. Males are obviously different than females, and we talked about that in the lab. In males, it's three parts, right? Prostatic inside the prostate, membranous inside the membrane. What's the membrane? Urogenital diaphragm. What does it mean? Urogenital diaphragm. This is a diaphragm, right? Diaphragm means a separator. Urogenital diaphragm, the diaphragm that separates urinary system from reproductive system, from the genitals, right? This diaphragm is under the bladder. Keep it in place. And within this part only, this tiny part is called membranous urethra. And what do we have inside this membranous urethra on either side surrounding the prostatic urethra? External urethral sphincter. External urethral sphincter. So how long is the male urethra? From 18 to 20 centimeters. Okay. And it ends at external urethral orifice. This is the opening at the tip of the penis, which is at glans penis. So here is right here, this point. This is the external urethral orifice, and the internal one was here, okay, in the neck, surrounded by the internal urethral sphincter. And this long one here is called spongy or inside the penis. So it's penile, it's inside the spongy part. So we call it spongy as well. Here it is for the females, it is 3 to 5. So like the male is like 5 times as long. Okay. So it just comes from the bladder to the vestibule. What's the vestibule? The vestibule is this area, this opening area within the structures of the vulva, which is, we saw that in the lab, right? The mons pubis on top, and then the labia majora and labia minora and all that stuff. This opening, generally speaking, the whole opening, I'm not talking about the opening of the vagina itself, with the surrounding. This whole thing here is called the vestibule. And this is where the external orifice open in females. It's right anterior to the vagina. So look at this picture right here. This is a vagina right here, and this is the opening. And here it is, the urethra. It's anterior to the vagina, and anterior to it is the clitoris right here. So it is in between clitoris in the front and the vagina, the opening of the vagina or the orifice in the back here. So it's open right here. Surrounded, this, look at this. This is labia majora. This is labia minora. All this space in between is called the vestibule, and this is where the external orifice open in females. External sphincter, in both cases, it's skeletal muscles, so it is voluntary. How about the internal? What kind of muscles? Smooth muscles. So that's why it's involuntary. Under resting condition, the external is closed. Is that clear? Under resting, what's normal? Like most of the 24 hours. Is it closed or opened? It's closed. The abnormal is when you voluntarily opened. So this is something that happened automatically. It's closed until proven otherwise, until you decide to open it. And we talked about the idea of females getting more, just statistically, both males and females get urinary tract infection, but females get it because of two reasons, not one. Shorter, this is one. And closer to that area where the pathogens, rectum and the rest of the organs. Okay, it's closer to the outside or closer to these organs containing a lot of pathogens. Now the reflex. Let's make it just simple. Bladder, the function of the bladder is temporary storage, right? So you start to accumulate or store the urine in the bladder, and the bladder is like this and start to like distend a little bit, okay, a little bit, until certain point where the internal start to open. when the internal open, there is a reflex go to the center to the spinal cord and come back to make sure that the external is completely closed. Okay? Otherwise, if that's not the case, the internal will open. You don't have control over it. It will open just because the bladder is full. But once it starts to open, a reflex will come and tightly close the external one. Okay? And the only way to open it is voluntarily. So this is called urine storage reflex. Okay? Internal start to open, a nerve go to the spinal cord, which is sensory. A motor one come back, not to the internal, the external. Internal, afferent, spinal cord, efferent, external. And it closed the external one. So look at this here. Urine starts to accumulate here, and this internal down here start to open a little bit. Sensory, go to the spinal cord and come back to what? Look here, to the external. Closing it and making sure it is closed until you decide um, to urinate. When it is the good time, you are going to voluntarily inhibit the external and you start the urination process. And this part is important. It is the reflex. I make it as simple as possible. It's a little bit more than that, but this is good enough. If you understood what I said, that's good enough. Okay. When do you start to feel the urge? Do you think it's when you have a liter? No, it's only 200 milliliters. Like if only fifth of the bladder is full, you'll start to feel like you want to go to the bathroom. Do you have to? No. You can just wait. Right? How about 300? How about half a liter? You can wait. As long as you have this reflex working, the external is contracting and it's not going to open. Okay? If it goes to the liter and you wait it, it will open because this is too much pressure. The pressure is going to be higher than the pressure of the external. Is this point clear? If you exceeded that, what if I have a liter and I'm still waiting? No, it's not going to happen because the pressure is too much. Overcoming the pressure of the external, it will force it open. And we usually don't go to that extent, but just for the purpose of understanding what's happening here. So if it is the good time to go to the bathroom, the signal goes, you inhibit the internal and you inhibit the external and you start the process of urination. Now, infants. We know that infants, they need the potty training, right? Like they cannot control it first, and later they start to practice it. We start to help them to understand how to control it and so on. Why is that? Because there is the wiring itself is there, the nervous system is there, but it's not trained yet. So this connection, corticospinal connection, the connection between the spinal cord and the cortex, and why I'm saying the cortex. Spinal cord is usually involuntary. The spinal cord, you don't have control over it. What is um, awareness? Which part of the brain represents awareness? Cortex, right? So you decide. What do you mean you decide? It's your cortex, right? You're aware. It's your cortex, right? So spinal cord is working, the cortex is working. Everything is fine in infants, but that connection between the spinal cord and the cortex, which need to be trained to be well established, it takes time. And by that time, the cortex will have an upper hand as the connection is full. Will have an upper hand to the spinal cord so it can inhibit. So what happened before that? What happened? That reflex that I talked about does not exist. So what happened is internal urethral sphincter, he start to accumulate urine, internal open. That reflex doesn't happen as it should, or when it happen, it can help him sometime. And then if you think it's not the good time, you have no control over it. It's all about the connection between the cortex, which is your awareness, your voluntary, and the spinal cord, which is involuntary. So that takes some time to develop and in treat practice and training. And it's normal. Um, I don't remember the number exactly, maybe like 4 years or something, 3 years, 4 years. But it should develop and it needs some practice. Incontinence is something else. Incontinence. Continence, if you are continent, means you can hold it. You have a control over it. In before it means no. So incontinence is inability to control. And this is not normal, of course. People can get it because of various reasons. Accidents that affected the nerve, accident affecting that muscle, external is broken down or injured. Any condition that prevents the voluntary control will lead to incontinence. So normal is continence. You should be continent, right? Which means you have the control. Incontinence, you lose the control. Age-related changes, just like everything else, everything goes down. All the functions diminish, decrease. You start to lose it. Glomerular filtration rate goes down. Sensitivity to the ADH goes down. Reflexes, not as good, right? Control over or the reflex, less. Just put less before anything and you will get it. Of course, it's more calculi or stones. Nephrons, the number, does it increase or decrease? Choose the bad. Decrease, right? Muscles, weaker. Stronger or weaker? Weaker. Nephron numbers, large or small? Small, right? Control, less. Everything goes down. Urine retention is something specific for males. We hear about the urine retention in males specifically because of what's unique about males that make them have more urine retention. What the males have around the urethra, only in males, not in females. The prostate. So with older age, automatically, the prostate is going to enlarge. And when it enlarge, it doesn't just enlarge outside, not just the size. It enlarge also from inside. So it's going to constrict on the urethra, the prostatic urethra. So the exit of the urine become harder, and we call that urine retention. It's not zero, but they take time until they evacuate the bladder. It's hard, and so on. It can be removed, by the way, the prostate. If like 70, 80 years, it can be removed if needed. Okay, that's it. Excretory system is not just a urinary system. You can use different systems to excrete. The main one is the urinary bladder, but how about sweat? Yes, does the sweat help the urinary system? Do you know that? Yes. How about if you have a lot of sodium chloride? You should get rid of it in the urine. What if the kidney is not getting rid of all of it? Not because the kidney is bad. How about those people who like to eat a lot of pickles or stuff like salted? If you're eating too much, your sweat glands are going to help. Did you ever see somebody having like white stuff on the skin? Did you see that before? This is salt. It can, if it goes out on the skin, it is the salt that's dried out on the skin because it's trying to help the urinary system. Respiratory system also help. You get rid of like at least vapor. Digestive system, you get rid of the waste products and so on. So this is how these systems are integrated with each other. And that's it.